Lines of Zan occur in coralline thrombus. Migratory thrombophlebitis is seen in disseminated cancer. All of the following are true of red infarction except it occurs in end arterial occlusion is false. What is true is it occurs with venous occlusion seen in loose tissues and occurs in previously congested tissue. Red infarction is seen in small intestine. Following pathogenetic mechanism operate in septic shock except increased peripheral vascular resistance. So which are the pathogenetic mechanism operating in septic shock? Venoconstriction, direct toxic endothelial injury, and activation of complement. The first effect of endotoxin is endothelial damage. Which one of the following factors is labeled as cytokine in the pathogenesis of systemic inflammatory response syndrome SIRS? Tumor necrosis factor. All predisposed to thrombosis except hypomagnesemia. So which are the predisposing factors to thrombosis? Homocystinuria, PNH and polycythemia. Thrombomodulin thrombin complex prevents clotting because the complex removes thrombin and also activates protein kinase C, which inactivates factor 5 and factor 8. Now, immunity. Features of innate immunity are all except recognizes foreign antigen in blood. So what is the feature of innate immunity? C-reactive protein. Complement protein is a part of innate immune system and it includes phagocytes and natural killer cells. Which is concerned with cell-mediated immunity? T lymphocyte is concerned with cell-mediated immunity. CD8 cell is T cell. All of the following are function of CD4 helper cell except produce immunoglobulin. So what are the function of CD4 helper cell? Immunogenic memory. It activates macrophages and activates cytotoxic cells. Primary role of T lymphocyte is delayed hypersensitivity. The following interleukin is characteristically produced in a Th1 response. Interleukin 2. Interleukin produced characteristically by Th1 responses, interleukin 2 and INFY. Plasma cells are derived from B cells. IgE, that is immunoglobulin E, is secreted by plasma cells. Following injection of lymphokine, the same class of immunoglobulin are produced. This is to be referred as clonal selection. Natural killer cells attack which of the following cell? Cells which are not able to express MHC1. Apart from T and B lymphocyte, the other class of lymphocyte is natural killer cells. All of the following statement about natural killer cells are true except they are MHC restricted cytotoxic cell. So what is true about natural killer cell? They are derived from large granular cell. They comprise about 5% of human peripheral lymphoid cell and they express IgG-Fc receptor. The following feature is common to both cytotoxic T cell and natural killer cells. They require antibodies to be present for action. Natural killer cells express CD16, C65, 61. Immunity against cancer cell is by natural killer cell. Natural killer cell CD marker is 16, CD16. Antigen presenting cell are Langerhans cell, macrophage and B lymphocyte. Most potent stimulator of nerve T cell is mature dendritic cell. Antigen presenting cells are all of the following except astrocyte, endothelial cell and epithelial cell. So antigen presenting cell are Langerhans cell. Langerhans cell, macrophage and B lymphocyte are antigen presenting cell. All are antigen presenting cell except T cell. So Langerhans cell, B cell and dendritic cell are antigen presenting cell. Before sensitizing T cells, slight modification in antigen is induced by Langerhans cell and dendritic cell. Langerhans cell are antigen presenting cell. Toll-like receptors recognize bacterial products and stimulates immune response by transcription of nuclear factor mediated by NF-κB, which recruits cytokine. Which toll-like receptor are involved in action of bacterial endotoxin? 2 and 4. Which of the following is not true regarding superantigen? they bind to cleft or antigen binding groove in the MHC2 molecule is false. What is true is bind T cells irrespective of antigen specificity of TCR, bind directly to both MHC2 and T cell receptor causing T cell activation, and bind directly to lateral aspect of T cell receptor. MHC class H1 genes encode tumor necrosis factor. Cell type which lacks HLA antigen is RBC. HLA is located on short arm of chromosome 6. The HLA class 3 region genes are important elements in governing susceptibility to autoimmune disease. MHC restriction is a part of all except autoimmune disorder. So MHC restriction is a part of antiviral cytotoxic T cell, antibacterial helper T cell, that is cytotoxic cell, and allograft rejection. Mixed lymphocyte culture is used to identify MHC class 2 antigen. HLA typing is useful in disputed paternity and organ transplant. True about MHC class H, it is not involved in innate immunity and it is present in B cells. MHC class 1 represented on all nucleated cell. True statement are all except class 3 MHC does not encode complement is false. What is true is chromosome 6 harbors the gene for MHC. Genes encoding complement are located adjacent to class 1 molecule, and monocytes have MHC class 2 antigen on their surface. HLA-B27 is associated with ankylosing spondylitis. HLA associated with rheumatoid arthritis is DR2. Which of the following surface glycoprotein is most often expressed in human hematopoietic stem cell? CD34. Not a B cell marker. So CD134 is not a B cell marker. CD19, 20 and CD10 is a B cell marker. All are B cell marker except CD15. So CD19, 21 and 23 are B cell marker. The marker for B lymphocyte is CD19. Memory T cells can be identified by using the following marker CD4-5RO. Which of the following is a pan T lymphocyte marker? CD3. CD95 has a major role in apoptosis. CD95 is a marker of death receptor. Which of the following is false regarding cytokine? It does not mediate specific reaction is false. What is true about cytokine? It is a mediator of inflammation produced by macrophage and are soluble protein. Cytokines include interleukin. They are polypeptide, that is complex protein, and highly specific action. Interleukin secreted by macrophages stimulating lymphocyte is EL, that is interleukin 1. Interleukin 2 is secreted by CD4 lymphocyte. Eosinophil are activated by interleukin 5. Type 1 hypersensitivity is mediated by which of the following immunoglobulin? IgE. The most important cell in type 1 hypersensitivity is mast cell. Mast cell synthesize or secrete histamine or heparin. Ramdevi presented with generalized edema, sweating and flushing, tachycardia and fever with after bee sting. This is immunoglobulin E mediated reaction. A 15-year-old healthy boy with no major medical problem complains that he breaks out with blocky areas of erythema. They are pruritic over skin of his arm, leg and trunk every time within an hour of eating seafood. The clinical features are suggestive of localized anaphylaxis. Type H hypersensitivity is mediated by immune complex, IgM and complement. Immune complex mediated reaction is type 3. So type 3 hypersensitivity is mediated by immune complex, IgM and complement. Type 4 hypersensitivity is cell mediated. Epithelial granuloma is caused by helper T cell. All combination are true except SCIC test is delayed hypersensitivity is false. So what is true is erythema nodosum leprosum is type 3 hypersensitivity. Post streptococcal glomerulonephritis is type 3 hypersensitivity. Mismatched blood transfusion is type 2 hypersensitivity. Which of the following immune hypersensitivity reaction is responsible for myasthenia gravis? Type 2 hypersensitivity. Example of type 4 hypersensitivity is granulomatous reaction. A 40-year-old man has chronic cough with fever for several months. The chest radiograph reveals a diffuse reticulonodular pattern. Microscopically on transbronchial biopsy, there are focal areas of inflammation containing epithelioid cell granuloma, Langerhans giant cell, and lymphocyte. These findings are typical for which of the following types of hypersensitivity? Immunological response. Type 4. Type 4 hypersensitivity is contact hypersensitivity. Type 3 hypersensitivity is the type 2 hypersensitivity is blood transfusion reaction. Delayed type of hypersensitivity is seen in the following except Arthur's phenomenon. So, delayed hypersensitivity is seen in contact dermatitis, tuberculin test, and graft versus host reaction. Arthur's reaction is what type of hypersensitivity reaction? Localized immune complex. Cell mediated immune response in which type of hypersensitivity? 4. Which is not a type 3 hypersensitivity reaction? TB is not type 3. It is rheumatoid arthritis, SLE, and Arthur's reaction, which is type 3 hypersensitivity. Allograft is between individual of same species with different genetic identity. Most important antigen initiating graft rejection is HLA antigen and MHC molecule. T cell recognize which antigen in graft rejection? MHCH. Preform antibodies cause hyperacute rejection. Histology of acute rejection of renal transplant or neutrophilic infiltration, necrotizing vasculitis. GVHD associated with solid organ transplantation. Graft must contain immunocompetent T cell and it is seen in immunosuppressed person. GVHD means graft versus host disease. All are affected in graft versus host reaction except all are affected in graft versus host reaction. Lung. Which of the following statement about graft versus host disease is least correct? It occurs when donor cells are immunocompromised is false or least correct. What is true is it occurs when host is immunocompromised and it is called runt disease and it is a common cause in stem cell transplantation. A common cause is stem cell transplantation. Not true about graft versus host reaction is none. So what is true is lymphocytic infiltration of portal tract, bile duct damage, intrahepatic cholestasis, require liver biopsy for confirmation, endothelitis, lymphocyte and portal vein. Autoimmunity can be caused due to all of the following except negative selection of T cell in the thymus. So autoimmunity can be caused by the pressure of forbidden clones, expression of cryptic antigens and inappropriate expression of the MHC proteins. Which of the following is organ specific? Goodpasture syndrome is organ specific. All of the following are autoimmune disease except sickle cell disease. SLE, grave disease and myasthenia gravis are autoimmune disease. Characteristic feature of SLE is polycirrhosis. Shrinking lung is a feature of SLE. In which of the following arthritis erosion are not seen? In SLE arthritis, erosions are not seen. What is true about anti-nuclear antibody? Double-stranded anti-DNA is specific for SLE. Speckled pattern is seen in anti-SM body. Wire loop thickening of glomerular basement membrane is seen in systemic lupus erythematous. Characteristic of SLE of kidney is wire loop lesion. Which of the following is associated with double-stranded DNA antibody? SLE.